good morning for some people and good afternoon for others. Let everyone get adjusted here. And I am excited to have everyone here today. And I'm excited to share many things with you. We're going to have a fun time. And as fun as you can have with platelet-rich fibrin and ezGEL, but to me, it's extremely exciting and fun. So buckle in and grab a bit of coffee. And we're going to talk about a few things today. I'm going to go into a little bit of detail on PRF. I'm going to talk about the new ezGEL and why we're doing it and some of the nuances. And I'm going to show you some before and afters. Most importantly, I want to bring value to you. So you're going to be able to ask questions in the chat function. So keep that in mind. You see a chat function there. You'll be able to ask me questions. Most important is that this is pertinent to your practice. And I know this is very new to some people. And honestly, there's a lot of people that have run with this and they're doing a lot of it. And so I've learned a lot because obviously through social media and all the platforms, people have reached out to me with their difficulties, trials, tribulations, and their successes. So I'm going to share some of that with you, and I invite you to ask me questions regarding that so I can help you. So that's kind of our agenda today. And again, look in the chat function. And to start, I want to, tell you, I want you to grow your practice as well, because many of you on here have practices. You're either injectors or you own your own practice. So the reasons for being here are many. Number one is always going to be our patient satisfaction and achieving results. And I'm going to talk to you about that today. What applies for ezGEL and for PRF is not just for that, but everything we do in our practice. So it's all patient focused. However, you're also running a business and you also have to answer to your patients, to their reviews, to your revenue, to your ordering of product. So it applies to everything, and I'm happy to talk about some of that today. So let's get started, and we'll pop up the first slides. What I'm going to do is I'm going to stop after each couple of slides and answer some questions. I'm going to go through some before and afters. I'm going to talk about how long these last, how long results are, what do I do for my patients, and at the very end, we'll take some questions that remain. So that's my goal. So ezGEL, of course, this is new. And, understand through the beginning of time, when new things come along, the first thing people do is they discount them. They say, well, this can't work, this can't be. And particularly companies. We're in an industry that is run by companies, and companies can kind of have us under a lot of control. So understand where we're at. And so that's the first stage. And the second stage is people start to go, there's something to this. So what do? They oppose it, and they violently oppose it. So if you see some of that, that's what happens. And third, what happens when everyone goes, oh, this works? Oh my gosh, everyone's coming in for this. People are happy. They go, oh yeah, I knew that all the time. So they accept it. So there's those three stages, and we're somewhere between 1 and 2. But the beauty with so many practices doing this, we're seeing those results. I'm going to share that with you today. Okay, so ezGEL is just that. So let's go to the next slide. And if we look at PRF, okay, that's just about me. No one wants to know about me. We'll move on. But I guess what I would say about this is I train for most of the companies. I've done this for, been in the industry for 25 years. At my peak, which was 20 years ago, I suppose, I had 8 locations and 85 employees. And, back then it was, of course, toxin and filling basic folds. And then it evolved from there. So that's my history with this. Let's go to look at what blood is. Let's look at the blood product. Okay. And when we talk about blood products, of course, it's all natural, and we want it to be all natural. We want to manipulate the human body as little as possible. Why? Because when the human body is functioning well, there's no better model for success and for well-being. We have it all within us because we have healing factors, and there's no need for anything more than what we have when things are functioning well. So one of the things about a product like this is patients are they're willing to do it. So there's understand the market. Let's talk a little. We'll dive into business for a minute. 0.003% of the population gets a facelift. 3% of the population gets the number one injectable product that we have in the world, which is neuromodulator or toxin, 3%. The other 97% of potential clients don't get it because they're afraid of us. They're afraid of toxins. They're afraid of filler. They're afraid of what they see in Hollywood. So if you want to do something like this, understand you can scale it because 97% of the people trust their own body. So we'll leave it at that. You can ask me more in the questions. Okay, so we can capture that all natural patient. It's an easy add-on. So if you love your fillers, if you love the fact that you have to wait for their discounts, the reps to come in, new products, if you like to pay half of your revenue plus to filler companies, you'll love to do that with toxin. There's nothing wrong with combining. So this works well with a lot of things. So if you like that, you don't have to stop what you're doing already. I don't. I use most things in my practice. I just happen to use a lot more natural as time goes on. And that's gone on for 20 years. If you graph my treatments, they've all become more and more natural because we have the technology. And it's often safe for people with what? What are you seeing walk in your door more and more? Celiac sprue, autoimmune disorders, arthritis. Our bodies are attacking itself. Okay, so this is their own body. And there's minimal consumables. So from a business point of view, if it's something that floats your boat and that you would rather make 80% on your procedures than honestly, what the average clinic probably running around 16%, 17%. So, and why I mentioned that consumable is it allows you to get better results for your patient because you can add it on and not break the bank. Or what about this? If you think about a surgical procedure, what does a liposuction or facelift cost the physician performing it? Well, almost nothing. It's their hands, it's their skill, it's their mindset, it's what they've learned, it's their technique. Why not get paid for your technique? And more you see practices doing that. They're realizing that. Next slide, please, and then we'll take a couple questions. So composition of blood. This is very important because I still get this. I'm going to not pay a lot of attention to this. I can take some questions on it, but understand this. I'm just going to say 10 cc's of blood, there's only so many growth factors and stem cells. So for you to think, or a person to think, hey, I'm going to get 4 cc's of yield from a 10 cc blood draw, it's not possible. There's this much. There's about 0.5 mLs out of 10. So like 3 or 4 or 5%. So you want the smallest yield possible. And it's contrary or counterintuitive to what everyone comes and says to me, hey doc, is this yield good enough? And they want to show me 5 cc's. No, I want to see 1 cc. That's concentrated growth factors, platelets, and mesenchymal stem cells. So that's the goal. Again, we got to change our thinking with PRF. Next slide, please. And let me see, let's take a question if we can here. I can pull up the chat. Let's see what we have. Okay, so I'll see if there's anything, and we can answer them again at the end. Okay, so yes, there'll be a recording. Okay, great. So no burning questions. I'll go through a few more slides. Let's pop through a few more. And that's good. If there's no questions now, we are going to get to them. So let's move on with the deck. And this is what it should look like. Okay. So you can see those tubes that we have. These are 13 ml tubes. Let me preface this. Obviously, through social media, people find me, YouTube, Instagram, and all those things. I get people direct messaging me from all over the world, okay? I got like 8 from India today. Those people don't have available to them the spinners and the tubes. They're trying to make this stuff. So I help them with what they have to try and make it. So I have a lot of knowledge about all the different tubes and what people are doing from that angle. Okay, understand these are 13 ml tubes. This is 1.5 cc's of yield. if someone comes and at a 13 mLs shows me 4 cc's, I know something's wrong. Because if you look to the top of the yield of the yellowish area, you must see it's getting clearer. That's the albumin. That's basically water. Think of it like water. Okay. Next slide, please. Okay. So the next generation from PRP, of course, is the PRF, because there are no additives and because we want a fibrin clot. And if you're using blood thinners, you're not going to get that clot. So when we talk about the tubes, yes, the tubes that you see here, the Cosmo France tubes from the ezPRF are going to be a longer length, 13 mLs. Why? So many people in different countries, when they're showing me their tubes, they get 5 and 10 ml tubes. The tube is very specific, and if someone wants to go into why, we can, but I don't want to bore people. Let me just say this. If I took a 10 ml tube, I put it into that spinner, I'm going to get a very different yield than that 13 ml tube. Now, let's say you handed me another 13 ml tube that's coated differently or that just has a slightly different diameter. I'm going to get a different result on the spin. So as people think spins and tubes, oh, just basic stuff, play with it. I have 8 spinners here, okay? So we play with things all the time, horizontal, fixed, angle, all that stuff. And understand it's all about G forces. It's crazy stuff. And these are more cocktail conversations for those interested. Just understand, use a tested system. That's what I just say to most people. And if you want to be the tester and test it yourself, there's nothing wrong. But most people want to have it done for them, including me, because you lose your mind. I lose my mind. Next slide. Okay. Remember I told you we only want a small amount. What are we doing here? Why is it that this is a new kind of an industry, a new procedure that needs to be accepted? Well, we know dentistry, okay, it's used in dentistry a lot. We know it's used in orthopedics a lot. In orthopedics, a lot of times for cartilage, right? So let's take that as an example, because many of us, if you're my age, you have knee pain, okay? So well, let's think of cartilage. What are they trying to do when they put growth factors with PRP or PRF into a knee? Okay, there's cartilage there. So you put it in and you have growth factors. In this case, PDGF, okay, platelet-derived growth factor, helps the cells divide and recruit. So we're going to recruit cartilage. The vascular endothelial growth factor helps increase blood supply. What do you want to do under your eye for your fat pads? You want a little more fat, probably. You want healthier fat, and you want better blood supply. You want healthier tissue. And then TGF beta, as an example, that also recruits cells and epithelial, endothelial cells for skin. So don't worry about studying these. There's 80, 90, 100 growth factors. There's growth factors we don't even know about. But understand this concept. It's not about yield. It's about cells. And the spin and the tube create that. Imagine if someone said, oh, I'm going to make up my filler. I'm just going to take hyaluronic acid out of my topical skincare, add a little bacterial cross-linking to it. I'm going to inject it in faces. You'd be like, you're crazy. If you don't know what's in your spin, how would you know what you're injecting? How do you know what your results are? Next. So I hope that part makes sense. Now, mesenchymal stem cells, remember I said with cartilage or with bone and creating bone or creating skin, that's a wonder of the body, right? Mesenchymal stem cells are cells that can grow into other cells, pluripotent stem cells. Where do we get them from? Okay, so there's sources. The umbilical cord, let's not go there. Bone marrow, if you've ever done one or unfortunately had one done, and I've done many bone marrow aspirates on people, it's painful. A patient's not going to come in and want you in their bone marrow. It hasn't improved. The procedure has not improved from when you were in medical school. It's the same. Fat, okay, great. Fat's good. Fat has the most stem cells, 10% stem cells, great. I don't have a lot of fat right now. I could go easily go to dinners and get some fat. I would do that, no problem. But I don't want you in there getting my fat. And here's what happens with patients. When you go get fat, how many come back and go, hey, that area in my belly, obviously the belly fat is going to act like the fat wherever you put it. And they're going to complain of a void or a defect where you took it. And then I come back and I'm saying, I'm not happy with my procedure. Are you going to take more fat from me? I don't want that done. And only a certain amount of fat takes. So fat's great for those who use it, for getting the facelift. How about the clinic where I just walk in, I want to be in and out, which is 99% of people, of course, 99.99. We have peripheral blood. And mesenchymal stem cells are in there, and they are studied to be in the spin of ezPRF. So whatever system you're using, likely they would have studied this, and that's important. You want to have them. Next slide. Okay, so again, I'm not going to go through all this. We can come back to it for the keeners here, but understand what we're trying to do is when you inject my under eye, I want those growth factors in there for as long as possible. Do I want them in there for 4-6 hours like PRP and gone? No. I want them to hang around there for days, weeks, and months and become viable because I want a better under eye. So we're looking for slow release, and that's why we use no additives. Look in your tubes. If you're doing PRP, you'll see sodium citrate or even heparin, and you would never use that for wound healing. Okay. People ask me, let's deal with this. Hey, can I add lidocaine to it? Why would you do that? I'm injecting something back into your own body that's pH neutral. It doesn't sting. PRF does not sting. And people want to, a lot of people want to invent stuff or create, I inject lidocaine or throw it on Instagram and be like, and get famous from doing stuff, but keep it simple, stupid. We learned that in Canada. And I still say the less additives, the better. We want slow release. Next slide. Okay, so let's see if there's any questions here. Okay, we're doing good. Okay, we have questions. Give me a question. Oh, I might have to scroll here. Do I? No. I'm in Q&A. Let's see if I gotta scroll it. I see some questions. Please tell about the centrifuge speed. Perfect. Okay, great. Here's the thing. The speed of the centrifuge is married to the tube, and they have a good relationship, okay, but they're married together, meaning I would only be able to tell you the speed if I knew your tube, the angle of your tube, the distance of the tube from the center, because that gives me the G-force. But for easy spin, for this centrifuge and tube, for just straight PRF, I'm using in general 1,000 RPM for 5 minutes. You can vary 800 to 1,200 as you get advanced in this. Those are all good spin speeds, but 5 minutes at 1,000. Now you throw another tube in there, it doesn't work, and you can visually see it, or you can not trust me and go measure your growth factor stem cells, mesenchymal stem cells, and see it'll be different. Now you could get a different centrifuge and it'll have a different distance or angle. It's all going to matter. It's crazy stuff. Okay, let's move through another slide. Okay, so so we went through some of this. Let's move ahead one more. But yes, it is a very quick spin and a very easy spin. It's literally 5 minutes and you're ready to go. Okay. ezGEL, of course, is where we're taking it. Now, why would you want a gel? There's many reasons why you might want a gel, but for me, I'm not a scientist per se. I don't think I'm a scientist. I study this. I am very interested in it. And as you see, if you want to study it, you'll go down these rabbit holes at 3 a.m. reading papers. But what I do know is the proteins unfold with the gel. I'm going to show you in a moment. They hang up the growth factors. I want that to sit there as long as possible. And the gel has been studied to stay there for 3 months plus. So I know the growth factors stay. Now you only need, in theory, this gel to suspend the growth factors for as long as they need to work. But in many countries, and people like volume, and they're just like when we use biostimulators. So what are other biostimulators? Think PLLA, polyl-lactic acid, PDO, polydioxanone, PCL, polycaprolactone. So there's many biostimulators. We want this product, the growth factors, to kick in as the gel goes away. That would be optimum, so that there's no, it's imperceptible. Take people who inject PMMA, polymethyl methacrylic acid. It's suspended in collagen. Okay, Artefil many years ago. As the collagen, and for those as old as myself, we injected collagen is the only thing we had. Collagen's gone in 6-8 weeks. But the PMMA beads build the collagen, so you hope it's seamless. This is the same concept with the gel. As the gel's going, the body's kicking in. And it's not always one-to-one, there's variability, but understand everything has variability. Your fillers, your toxin, your RF microneedling, all your devices. Okay, so
you're on the chat, you want to go to the Q&A.
Okay, go ahead. I'm going to have this adjusted for me so we have Q&A. So regenerative properties. So understand that part. Okay, here's Q&A. So we're at 16. Okay, so mixed with fillers. A couple of these I'm gonna talk about. Well, let's take that one. Yes, you can mix PRF liquid with fillers. Here's the thing. There's really no need to now. And if you get PRF and you mix it with a filler, it's going to clot pretty quickly. We used to do that before the gel. The gel is way better. But if it floats your boat and you want to mix it with fillers, go for it. If you want to mix it with a liquid biostimulator, PLLA, if you're using PDO, I don't know, we have people from all around the world here. PDO is common if I'm in Asia, which is what we use for threads, but liquid PDO is common in other countries. PRF does mix well. I've done that. It mixes well with those. In regards to EZ-PREP, I know injection fibrin. However, for clients who are used to PRP facials with microneedling, can you do microneedling with PRF? Yes, microneedling with PRF is, I would say, better, way better. I don't think it's monumentally better than PRP if you're just doing microneedling. Now, when you inject it, it's monumentally better. But if microneedling, collagen induction therapy, CIT, collagen induction therapy, in and of itself gives good results. But PRF is what I've used when I threw away my PRP 2015 or so. What are the ingredients formulating the gel versus regular PRF? I'm going to go through that. Stay tuned. And then let's talk about vascular occlusion at the end. Okay. I have some information on that. Okay. Now, let's go. Okay. Let's go to, let's go to the next, the slide. And then I'm going to come back and answer these questions, particularly that vascular occlusion one, because I think when you go to a conference, you guys, and I'm there with you sitting in the audience, the first lecture of the morning, they get up there and what do they say? You go to any conference, the first slide of the morning is going to be the worst vascular occlusion you ever saw. And that's called the hook. You know, if you're in social media or for YouTube, we hook them at the beginning. They get the hook. They're like, oh, now I'm going to stay for this whole lecture because I want to avoid that disaster. In anatomy classes, you can know your anatomy. You can go to 30 anatomy courses and come back to your clinic and go, what do I do now? Okay, so I'm going to go through some real life stuff for you because that's what I'm interested in, real life. So ezGEL is created by combining the gel, and we use it in a 2-to-1 ratio. I'm going to show you that. Let's move one slide ahead because the visual is going to be better coming up here. Okay, so I'm going to come out of this for 1 sec so I can see. Okay, step 1, 2, 3, and 4. Step 1 is going to be your top left. So I want to take you through the process to understand what we're doing. We got 2 tubes, and we're going to draw 2 tubes of blood. And then we're going to put the blue one, think of blue for cold. Blue is ice, Canadian ice. Put that in the cooler, right? And then you're going to take the tube with, what would you call that top? A caramel. We'll call it caramel top, brown top. And we're going to spin that fast. Now, I told you not to spin things fast because you're going to get water and albumin, right? We want the albumin, okay, because there's not a lot of cells in there. We spin it fast. And then we extract that and we heat it because there's not a lot of cells in there. Great. Step 3, we take the cooled one and we spin that slow. That has our growth factors. Step 4, we mix it back. So that's what we're doing. Let me talk about cooling, because do you remember this? For those who've done PRF, you're going to go, oh my God, I forgot about that. And you remember you lost your mind because this stuff would clot. And how many calls I get in 2015, Rajani, this stuff doesn't work. It clotted, a premature clotting. And you don't see that anymore. Why? There's a couple things that clot PRF or blood. Obviously, if you have sodium citrate or heparin like PRP, it doesn't clot, but nor does it work, in my opinion, not like PRF. So what happens with, what makes it clot? One is the tube. If you have a tube that's not ionized or perfectly smooth, when you spin it, it sees an irregularity, boom, clots. You take it out and you got to go take another blood draw, and it happens to be a male who passes out 3 times and has no vein, no antecubital, and you're like, okay, this is the worst case. Okay, so the wrong tube. The next is if it sees air or oxygen. So you take the top off to extract it, and it could clot. Okay, great. The other is temperature. If you heat it, it clots. Thus the cooler. So understand, but I want to take you back there to see how far you don't even think about PRF anymore, or oh my God, if for those doing PRF going, yeah, it works, high patient satisfaction. You don't even think about all those things you thought about 5 years ago. We're going to feel about gel the same way 3 years from now. Okay, next slide. Keep in mind with your 2 tubes, you're going, for those who love volume, okay, you're going to get 4.5 mLs is my average of product to inject. And this is just another visual. On the left top, you see the spinner, the heater. My personal preference, I have one in every room. I want one in every room. I don't want to have to take the blood. I have spinners everywhere because I don't want to take the blood from the patient's room. Remember, the patient's first, patient safety is first. When blood starts traveling in a clinic, I just personally don't like it. We all make mistakes. We all have off days, and you have staff running around. So this is just what I do. Whatever you want to do is fine. This is what on the top right, the gel looks like. And let's talk about this issue because I know it'll be in the question. Do you see the firmness of the gel? I heat for 10 minutes. I look at it. If it looks perfect, great. We love perfect. If it doesn't, if it's a little liquidy, I put it in for 1 to 2 minutes more. Keep in mind, this is a human body. Okay, so there is variability. And remember, I said pay yourself for your mind, for being on this webinar, for all the great things you learn and the vascular occlusion that you're forced to look at every conference you go to. Okay, pay yourself back. So you now know, yes, it's somewhat cookie cutter, but as you become experienced, you're going to play with this. And bottom center, I'm mixing back the PRF liquid with the gel. And I'm going to take you to another step of thinking here. Many of you are already doing this, but you can change the ratio. So now imagine for the advanced users on here, you go, oh, I'm making this great. Instead of doing 2 to 1 gel to PRF, you could go 1 to 1 because maybe the under eye looks really good. You don't want a lot of volume. Most patients coming in now, so many are under 35. The rock stars of the world want more. And you might not want that G prime and force. So you can play, I'll use the word G prime, even though it really doesn't mean much. We know it from the filler world. You can play with the consistency of it in way some people think we'll say G prime. Next slide, please. Okay, let me go. I'm going to go to your Q&A here now that I've learned this. Okay, so let me scroll. There might be a scroller on here because I'm seeing 17. Okay, maybe you can help me scroll. So the autoimmune condition question. So patients with autoimmune won't be affected by their blood. Well, you know, I haven't studied every autoimmune disorder. What I can say is, of course, like you, I have patients, and I think part of this is when you're getting your information on all this stuff. Great. Think about, take your information from people injecting faces, okay? And it sounds weird. It sounds like, why is Rajani saying this? I'm teaching you this because I'm doing it every day in my practice. I'm not telling you something that I did yesterday and I'm selling you on, I'm just giving you information. You do with it what you want. But when I have patients with autoimmune disorders, I don't necessarily jump at PLLA or PMMA and inject it into their face. Even as we saw not to get on the vaccination road, but it gave us a lesson that these are foreign bodies when we're putting fillers and everything in. We know this, but when the patient comes back with the face that's blown up, we're reminded of it. I've never seen it with the gel, okay? And it makes sense. It's their own body. I've never seen a reaction to it. Never say never in medicine. So I'm not saying never, never, but I haven't added anything to go back. There's nothing coming from the tubes, nothing. PRP versus PRF, same number of growth factors, around 150, but the difference, how long they last. Okay, so it's a loaded question a little bit, but PRP, I'm going to think about the same number you asked, Stephen asked, same number of growth factors. So let's say quantity. Let's say you spin the tube and you get 5 mLs out of your 10 ml tube. Let's say 4, because that's more what people would get, 4 mLs out of a 10 ml. Spinning it at, say, 3,500 for, let's go, 8 minutes, whatever you're doing. No, it's not the same number because you're injecting 80% water. Remember, there's only 1% of goodness in 10 cc's. So do you want to inject water? Great. I'll give it to you for free. Why take my blood? Okay, so I think we're getting concentrated growth factors and stem cells. So I think it's very different. But remember, part of it is the clot formation. Because if I got cuts on me right here, look, there's a cut right there. Okay, so if you're doing stuff in life, you're going to be cut. That's 3 days ago. There's a scab on there. Okay, so without that scab, I don't heal. And you won't even see that 4 days from now. It's ridiculous that can happen. But that process that's occurred here, I'm not going to change it. I'm not going to put heparin on it. I'm not going to put anything in it. But that's concentrated growth factors and stem cells. So different. Are patients with a history of thrombocytopenia condition candidates for PRF? Yes. You always want to know their platelet counts. But I have patients with that. There's different levels, of course, and there's different reasons they have thrombocytopenia. So idiopathic, yes, I treat them. They know their level. But remember, yes, okay, you want the platelets, but why do you want that layer? It's because growth factors and stem cells hang out with the platelets. That's why we're spinning it. It's not about the platelets necessarily per se, although they're important, but they have the growth factors in there. So yes, you can. I offer both PRP and PRF in my practice. How are you explaining to patients why you choose one or the other? So what I did, just personal history, I did half bases for 6 months, and we had both for 6 months. I like to have a lot of stuff. I just threw away the PRP because we did under eyes where we did about 500 to 1,000, and we did everyone. And the PRP, we just didn't get the results. So you do whatever you want to do, but don't explain. You can explain to your patients if you want, but remember, you're the boss. Who's the boss in the practice? You're the boss. Okay, so why would you offer what you believe is inferior? And if you like your PRP better, throw your PRF away. I've never seen that. And of course, I probably get skewed a group of people, but I don't think so. If I'm in a crowd of 500 people, I'm lecturing, I ask people, PRF people put their hand up all day long. The PRP are like, I don't know. So aside from being able to treat areas you can't with Sculptra, how do you feel this compares? Does it replace? Nothing's going to replace Sculptra. Nothing's going to replace fillers. Nothing's going to replace toxin. However, I think if you want to open up a practice today and only do ezGEL, I think you could. And I don't say that lightly because 25 years ago, I pretty much only offered hair removal in 9 locations. For all practical purposes, 10% of our revenue came from injectables and IPLs, and 90% was hair removal. It can be done. Because it's all natural. More people will do ezGEL than not. But let's talk about results. Sculptra, of course, it's a foreign body. Of course, there's some people you can't use it in. But if you were, say, doing a temple, I want volume. I need a lot of power there. I typically still will do Sculptra. Under eye, front of the face, lips, lower face, totally different story. I want better skin. I don't want volume down here, right? So they're tools. So it wouldn't replace it. Noticing that the spin rate and temperature are different on this chart to how I was originally trained, 73, 75. Isn't that a great question? Things evolve. I still use between 72 and 75. I'm playing with it all the time. The key is 72 and 75 are great. Anywhere in there is great. Look at it at 10 minutes. Add it back if you want. That's the story there. But 72 to 75 is great. I went 77, of course, to 85 when we're testing all this. It was frying the stuff. So don't go too high. I would say that. If you go too low, you're going to take too long to do it. But if you have the patience, it will unfold the proteins. Okay, let's go to a couple more slides. Okay, let's answer this question because it's a hard one. I just see a negative, not a negative question, but something I can help someone with. I've been having a lot of issues with my ezPRF clotting, and I've temporarily gone back to PRP because I don't know what I'm doing wrong. You are doing something wrong. So it's good to know, right? I've done something wrong for most of my life. Okay, I'm learning every day. The most important thing you can do is admit you're having a problem with something and get someone who can help you. We can help you. We don't have that problem. It doesn't clot anymore. First of all, you can reach out to me on your dashboard if you're on aesthetictrainingcenter.com for the easy course. Get a hold of me somehow, Cosmo French. I'm happy to help you personally. It shouldn't be a problem. Do you have the cooler? Even without the cooler, you should have 20 minutes. But if the cooler is the simplest answer, don't invert the tube. Remember, I mentioned if it's agitated, if it sees an irregularity in the tube, it will clot. But that shouldn't be a problem any longer. I can absolutely help you with that. How long in the freezer? You know, it's somewhat controversial if you need to cool it. I still cool it. I look at the data, I look at the information. I cool it for 2 minutes. This may evolve as we go forward. Can I mix it with amino acids or are the cells too sensitive? Great question from Cheryl. Again, one of the things I find in the aesthetic world, people are trying to invent things and make things up. What's the data on that? I don't think there's anything wrong with adding amino acids. What's the pH? Which amino acids? Are they tested? So because this works, and I can tell you, I've done hundreds and thousands and thousands, I almost want to say tens of thousands of faces with PRF. I can easily say tens of thousands of faces with PRF. I'm in the hundreds and hundreds and hundreds with the gel. Don't reinvent the wheel. This is fun stuff. So if you want to, certainly go do it. We need youth coming up here to do this work. But I don't add anything to it because I know it works. I would add them after or not, but test it. No data on that. Sometimes I've had to do the fast spin twice to get enough yield. Will that hurt this process, or does that mean that the quality is not as high? You shouldn't have to double spin your PRF. Once in a while, for sure, you look at it and you do 5 minutes and you do, let's say you're doing 1,000 for PRF and you look at it, didn't separate? Absolutely, you have time. Throw it back in. What would I throw it in? If you did 1,000 for 5 minutes, I would throw it in at 1,000 for 1 to 2, relook at it. Some males, particularly because some of them are on the testosterone and all the stuff, I find they will have that. So everyone's blood is different, but yes, you can respin it. No, it won't make it less, but just 1 minute. If you cranked it up to 2,500, now it wouldn't be good. So can you use ezPRF for injecting in the joints? I'd love every one of my joints injected with PRF for sure, but I have no data on it. Keep in mind, there's no heparin. It does clot. I don't know the answer to that. Okay, let's go to the next slide. I'll go through and I will get to these questions. Okay, let's come down here. Okay, so let's go to, you guys want to do a video here or do you want to go through slides? There's a little video maybe that you want to do, or we could just stick to slides. I don't know if we have time to do a video, or I'm happy to do whatever you want. Okay, so what are we doing with ezGEL? Okay, yeah, let's talk real quick about symmetry because this is practice building. If people don't recognize their asymmetries, I say, hey, our bone's different. Faces are sisters, the sides of our faces are sisters, not twins. Bring up the asymmetry. If not, no matter what, they're going to come back saying you did it. Have great pictures. I like 3D imaging. But symmetry adjustment obviously can be done. It's all natural. We're always looking at symmetries in the faces, whether it's a nasolabial fold, a high cheek, an under eye jawline, they're all going to be different. But pointed out not to build your practice and be mean or to get people to think about it, but to say it's normal. But I'm going to add a little more on this side. Every time I treat someone, I get them more towards symmetry, keeping in mind, and I tell them this, a fully symmetrical face is thought to be less trustworthy. So we're not making you 100% symmetric. So we're natural. So symmetry is yes. Rejuvenates the skin like nothing else. I'll leave it at that. Those doing PRF, you know it. Stimulates collagen production. We talked about growth factors. That's the holy grail. We lose 1% of collagen per year, and it's like a cliff. When estrogen goes down at 47 to 53, you're going to see estrogen loss in your practice now with people 35, 37, 38. You're seeing it every day. Skin types 2, 3, most at risk. Collagen, keep it, make it, whatever you have to do that's safe. Reduce signs of aging, certainly, and acne scars. Okay, next slide. Ask me questions on those if you want, but it's amazing for all of those things. Where do I inject it? Okay, here's what I do with it. And again, we all have our own practices. It's great. That's the way this should be. But what do I do? Okay, I do full faces for many reasons. One is financially, it's way better for practices. Remember, we went through 2 years of trouble, okay, just now, meaning people couldn't come into clinics. We were wearing masks, the whole thing. We learned, if you didn't start 15 years ago like I did, and we all did, you learn that the more you do in that one sitting, the better, and the happier the patients are. They don't, as much as they love you, they don't want to come back. There's a select group of patients, the ones that are working, don't want to come back and see you every month. A lot of people do like that, but oftentimes those with money, time is money. They don't care about their money, they care about their time. And so I do full faces, and it's so much more rewarding. So between patient satisfaction, revenue. So what do? I do 4 tubes of blood. I do high cheek, under eye. I do a lot of nasal labial folds with this, which I was not doing before. Looks so natural. Chin, doesn't add volume, just a subtle volume, but it makes that skin so much better. Lips, vertical lip lines has been a huge surprise. They go, there's no way this is going to work on lip lines. Whatever growth factors are doing, whatever's happening down there in the lip lines. And when you do this, and we do this in our trainings, I'm leaving today. We're doing 2 trainings the next 2 days. We'll have 20, 30 people in there. When you do this in your trainings or in your practice, you're going to see them back in a month, 2 or 3. And you're going to be like, vertical lip lines, this worked. How did that work? I didn't resurface them. I didn't do filler. I didn't do toxin. It's making the skin better. But I do way more lips with it and lip lines. And I'm a very cautious lip line filler. And I would say normally toxin, resurfacing everything. Doesn't mean you can't resurface at the same time, but you're going to get better results than you think, lips and lip lines. So those are the main areas that I do. The big heavy hitting, big volume where I want to do like a temple. A temple is like 10, 20, 30 cc's. I often will still do Sculptor or PMMA. Jaw lines, I've been doing more with this because when I first started doing, I'm like, there's no way it'll give me that sharp jawline and that nice look. But it does look really good. And in fact, if you watch my YouTube, I had it done. So, do this stuff on yourself and then you'll see it's the best gauge. Next slide. After this next slide, we'll go to some questions. So why is it the treatment of choice for your practice? Well, obviously this is the future of the way things are going. You're going to see more published articles coming in the next 5 years about, and again, I like fillers, I like collagen stimulators, but about more collagen stimulation, more natural treatments, less things like implants. And of course, I consider fillers, PMMA, that is a form of an implant, a foreign body. Things are moving towards more natural. And the filler face, and the fact that filler lasts in the face for 10 years. So remind me, I want to talk about longevity, how long things last. A little lecture, I guess I'll put you through here about, because patients are going to say, how long does it last? I want to talk about that. It's cost effective to prepare. So let's suppose I come back with my under eye and I go, you know what? I'm not happy. I didn't see enough result. The worst case scenario, I'm grabbing a tube that doesn't cost me much. I'm spinning you're going to spin a tube of my blood and you treat me again, and you're not out $300, $400, $500. You're out whatever that tube costs you, which is very little. And it's all natural. And what am I going to sue you for? The stuff that came out of my body that went back into my body? Unlikely. So understand that for a practice, it's an invaluable tool. So it's versatile. Enables growth factors to release and biostimulation. Okay, and of course you can combine it with anything you're doing in your practice now, and ask me in the Q&A. You can combine it with. I haven't come across anything you can't combine it. What's one of my favorites? I will do the full face, of course, 4 tubes. So we're going to have almost 10 mLs of product. I'm going to put liquid PRF in the brow. I'm going to put under eye gel and liquid. I'm going to put nasal labial folds, lips, chin, a little in the jawline if they need it, smile lines. At the very end, I'll grab a fractionated RF. Boom, 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 boom. Takes me 10 minutes. And now they've got resurfacing too. And yes, I do it at the end. There's not enough heat, depending on what your device is, to kill the stuff. Okay, you're not getting to the temperatures you think of. And it's not deep heating, it's fractionated RF. Whatever you have in there, there's a way to combine it and improve the healing time. Let's see if we have, let's go to the Q&A, because that is the most worth for you guys. Would you say ezGEL is safer than fillers? In this, I'm going to give you my opinion. I guess that's what you're here for, a little bit, my opinion, but 100%. For one, it's your own body. Obviously, if you take a filler, it's hyaluronic acid. Let's talk about, we'll go to the vascular occlusion. There's 10 things in my mind to tell you, but we'll go to that in a minute. It's part of this question with safety. But let's just talk about it from an implant point of view. Bacterial cross-linked, most fillers in this and most countries are bacterial cross-linked gel fillers, cross-linked 1 to 20%, okay, whatever you're using. Now, that's an implant, it's a foreign body. You've seen delay, who's here's had delayed onset nodules? Who here's had granulomas? Who's here had vaccination swelling? You got your fillers in your face. If you've ever gone to Central America or Mexico, which is part of North America, of course, but Central America, I'm thinking of humid places, different parts of the world. You get up in the morning, and I still probably have fillers in my face. It's probably been 6 years since I had an HA filler, 5 years, except a little along the jawline. But a long time up here, almost nothing in years. But if I go to a humid place, I'll be like, boy, I look a little bloated. And it's not from the cocktails the night before you're going to say that. You get off the plane, you get out, the humidity, and the water's being attracted to the filler. And that's the inherent problem. So is it safer than fillers? For me, in my practice, way safer. Let's talk vascular occlusion. So we get to that for those that want to get out of here, but we're going to keep asking questions, but I know this is a hot topic. I'm going to give you opinion again. People are, you're going to be taking anatomy course after anatomy course. Now, anatomy is so important. Let me preface this. But if I send you to an anatomy course today, very important. You're going to learn where to go. I send you to a second one in 6 months, reaffirms it. Why are you going every year to refresh yourself on an anatomy course? Because you come back to your practice, you know where the superior inferior labial arteries, you know it crosses at the third, all this stuff. It's a centimeter, the facial artery coming up from the oral column. You know all that. Great. When you inject, that's all out the window. Everything is everywhere. That's the answer. You need to know your anatomy. So that's point one. Everything's everywhere. Vascular occlusion. So it's something to be known. It's something to have a plan, have a protocol. But it's also on high alert, because when it happens, it's a bad thing. The second thing about vascular occlusion is, of course, it's not the most common worrisome thing in your practice. You have probably more risk if you're in the United States of being sued than having a bad vascular occlusion, being sued over something else in your practice. So where's your risk stratification? Those amino acids we talked about. Imagine adding something that you have no idea, have never added. People want to microneedle Sculptor into a face. Where's the data on that? What happens if you get a granuloma there? Sculptor is a deep product. 2004, we injected it intradermal. That was a bad thing. And now you want to microneedle in? Where's that come from? So think, risk stratify where all this lands in your practice, including blindness. Now, so keep a level head about what we're talking about. We're not talking, chance of a car accident, 1 in 100, of dying or being maimed, 1 in 100. You drive every day and you get in Ubers with people who you don't even know, crazy people sometimes, and you're driving around. Now, what do? There's never been a case of vascular occlusion with ezGEL. In the literature with PRP, there is a few cases. If you look at where they came from, there's 2 or 3 that I can think of off the top of my head. I don't know the whole world. I don't know every single article out there, preface that. But there's 2 or 3 that are brought up to me all the time. A lot of times, unlicensed providers, one of them was mixed with hyaluronic acid filler, and that wasn't brought up, but it was. So pure gel, there's never been a documented case that I've ever been made aware of. And of course, I communicate with people all around the world. So understand your risk. You're taking way more risk just having this coffee with MCT oil in it, okay? Medium chain triglycerides, okay? You know what they do. So digestively. So, you know, you take more risk of that than you probably do injecting. Now, what if it happens? So and I've had where I've seen it in a lip, pure PRF, turn a little white. Now, when you put something in, when you do anything to the body, the vascular system is going to do something, right? It's sensing trauma. So all the cases, including mine, it blanched for maybe 3 or 4 minutes. Massage, warmth. If you go to the neck, aspirin's always a good idea. Obviously, there's contraindications to aspirin, certain things, but aspirin's a good idea in general, unless they're bleeding out or have a brain aneurysm or something different. Nitro paste in this case, I think, is a good idea. Again, there's 0 cases to go on. So massage, heat, and those are the only 2 things that ever people have told me that, hey, I saw that happen. I did those 2 things. It went away after a couple minutes, and that's very few. The next stages would be hyperbaric oxygen. Nitro in this case, I don't think you'll get as much of a steal effect. I want to tell you one thing here about fillers. Think about this. If you came in here and you cut me here and you clamped off my facial artery, what would happen? Not a whole lot. But if you put filler here, all of a sudden you get blanching and the whole thing looks like it's gonna necrose off. Fillers do something special to the vessels and to the vascular system that is more than we know. And I don't think we know yet. So that's something to think about. There is, and the last thing I'll mention, I am testing things right now that are purported to break up the albumin, because that's what we're talking about, the albumin, the fibrin clot. So it's in the testing phase, even though there's 0 cases. I think it's interesting to look at. So risk stratify what you're doing. And the first thing when someone walks in or you're getting a training, yeah, you want to know about vascular occlusion, but there's 30 other things that are much more common that are going to trip you up. You might have more questions on that, but that's how I'm going to leave it. We know albumin retains water. How does the gel not draw water in? Well, it just doesn't, okay? But this is complex. So the albumin unfolds, and you can study this. I guess Madeline's asking this, study it, and there's papers on this of what it does. But I have never seen beyond 2 weeks. And if you overfill with gel, you'll have people out 4 to 6 weeks that are a little unhappy, because I was overfilling at the beginning. And now I just fill to where my eye says it's good. Don't overfill with the gel. So yes, you could theoretically have that. Could water draw in? Yeah, I haven't seen it. I've never talked to anyone that sees it. First 2 weeks, you don't know what it is because you put a cannula in there, and I only use cannula. 23 gauge are great. And so you don't know. You don't know. It could draw water and could it happen? Yeah. What do you think is going to draw more, an albumin or filler that attracts 1,000 times its weight in water? I'll take the albumin, but I haven't seen it, but certainly. Can we talk about injection needle gauge sizes, please? Absolutely. I personally, and you'll see a video, old YouTube video of me doing a PRF in the brow up here. I do it for hair growth. I love it. Not personally, but on my patients. I got too much brow hair, so I can't do it. I'm not a candidate, but patients love it. People want brow hair now. I do, and I think obviously you have your supratrochlear and supraorbital and supratrochlear arteries up here. So I never use the needle. That's an old video. I always use cannula. 25 gauge, if you want. I'm moved to 22 gauge, and now I have 23s to use. I think 23 is the sweet spot. 2-inch, less openings in the face, the better, just for patient satisfaction. But a 1.5-inch 25, I think, is reasonable as well. The smaller the cannula, the more it's going to act like a needle. So you decide. When would you choose PRF over ezGEL? Jacqueline, great question. Here's what if you want a bit of volume, of course, you're going to take the gel. If you want the growth factors to be there for a long time, of course, you're going to take the gel. It's going to hang them up there for 3+ months typically. I tend to use, in general, liquid PR for the brow. Unless they need projection, then I will use gel. If the under eye looks real good and I don't want more volume, but they have a kind of a dark circle, and dark circles could be skin, this isn't going to take brown spots away. What I think it does best is genetic dark circles and vascular lymphatic obstruction, either from fillers or just because we have it. Like my ethnicity would have that problem. Okay, PRF works well for those people. And so that's where I would use it. And that's where I would use a liquid when I don't want that. Pretty much, unless I'm not thinking of everything, the lip, someone has lip fillers, you don't want to add more, but they want a bit of pop, they want redness, they want some growth factors, they want a little pick-me-up. I would only use the liquid PRF there. The upper lip, I've been using the vertical lip lines where you don't want a ducky look. You might go just liquid. I've been adding just a little bit of gel. I think that's a tough area. I want the growth factors there as long as possible. Francine, have you ever had exosomes with your treatment? Oh, Francine, I want my treatment. Get my appointment in there. We have the queen of threads on here. Yes, I'll take the exosomes with the treatment. I've never had them with my treatment. So, but you know, people are doing exosomes. Certainly. What I do, I use skincare with growth factors afterwards. For those wondering, growth factors and exosomes, again, another, this is where medicine's going, and there's signals that tell the body build collagen, rejuvenate. And with ezGEL and ezPRF, my personal, this is very personal, I'll tell you my opinion, is I don't want to change anything about it. I'll do it after, I'll do it before, because I know it works. But also, I'm here to give you information. If I was mixing all this stuff, how would I know? Unless I did a few hundred people with ezGEL and saw results and saw them come back, how can I come here and lecture to you and tell you these things? And it's honestly, in the training world, it scares me a little bit. People training don't do this in their practice, and they're coming to teach people. I don't get how that's possible. So keep in mind, when someone comes in to train, you say, how many hundred have you done? And that goes for high frequency ultrasound, RF microneedling, CO2 laser. How many CO2 lasers did I do back in the day? I started somewhere, but I would never teach it until I did 100 or 200 faces. So keep that in mind about information right now. It's like PRP, you get a flood of information from people who don't do this stuff. What type of collagen is stimulated with PRF gel? So the types of collagen, well, it's a great question. The short answer is no one will know. However, what's in your skin? Type 1, type 3, and cartilage bone type 4. So, but why I say this and why I think that's Jordana, no, who asked that? Let's see. It's already gone. But why I think that's a great question is think of the growth factors. If you're using it on bone to put a tooth in or for gingiva, the gums, you can create, the theory is, and it's been studied, you can make that. So theoretically, by putting it on the bone, it's theoretical that we're making bone. And I say theoretical because I'm very cautious of the information I want to say, but there's studies on this. So you can look at them up. You can look them up. But so we can probably make type 4 collagen and other types and bone. So what do I do on the eye when I see an older white female where I know the eye socket has gotten bigger and rotated? That's basically the bone of your face melts, if you want to think of it simplistic terms. I go 2 layers, one on the bone and one superficial for skin, because I do think we change the bone. Okay, we know a little bit of that from Sculptra, but with PRF, there's evidence of this. So very important point. Can you bolus inject the PRF gel into the cheeks? You know, bolusing is risky, as you know. I use cannulas. You can do anything you want. I mean, you can take this stuff and put it in the ear if you want. So can you or should you? And there's 2 different things. I'm sharing my practice of medicine. It's called the practice of medicine because I don't know, I'm practicing it. We're learning. That's what medicine is. So could you do it? You could, but why bolus it? Because what we're doing, remember, concept change in the mind. Take the front of my cheek, okay, which where I had it, and you can go watch on YouTube my treatment. It's a 35-minute video, but I put it up here. And honestly, there was I don't know what you can see through here. It was blatantly hollow through here. And I didn't want to do filler, got the gel, put the gel in there. Best treatment I've ever had around the orbital rim. Okay, and you can watch that treatment being done. It's totally smooth. It was about a month and a half ago. Okay, hopefully it stays for the next 2 years. I don't know. But what happens is the growth factors and stem cells is what I'm concerned about. So do I want it bolused here or even here? No, I want to blanket the area because I want my fat to get better, my bone to get better, my muscle to get better. So that's an idea. In a knee joint, of course, you're going to bolus it because it's a closed space with liquid in it. So it's like putting sculptor liquid in a face. You know, you can bolus it because it's water, but this is a gel. Have you used ezGEL for hair growth stimulation PRF? Do you change the treatment interval of the gel? Wonderful question. I've used it. I can't tell you because I personally am not going to tell someone. So if I've done, my number is 100, and I'll tell that to people when they say, Dr. Rajani, I want to be a trainer. Have you done 100? Come back and talk to me. 200, 250 is way better. So I can't tell you if it's better. I've used PRF, of course, hundreds, and I add ezGEL to it regularly, but some people don't want ezGEL. But I think it's a great area. If you want to try that gel in the hair, you should, and get a series of patients. I think it'll be fascinating. Do I think it will be better? I do. I think it'll hold it there longer. How do you price ezGEL? This is a great one. Let's go into some business. How do you price ezGEL versus PRF in general? Do you charge more for ezGEL because there's more volume? Let me tell you what I think about price. And I've said this for 2 years, and I think I'm right. It ends up being that I'm going to be right with most patients. And here's what I mean by that. I think everyone that walks into your clinic is $5,000, and I don't see how it isn't that way. And I take that from 20 years ago. When people came into my clinic and they had thermage, it was $5,000 face and neck. Fast forward, 2009-10, Ulthera comes, $5,000 full face and neck. And you walk in and you're going to inject something. You're all worried about occlusion. And you're going to inject something into their face that could occlude, that's a foreign body, that's going to last 8 years. I'll just say a filler now. It's going to last you 3 to 5 years, 8 years. You know that. It'll last in the face a long time. And you're going to charge them $700. You make sense of that to me. And who needs one vial of filler? If they get their cheeks, they need here, they need lower face, they need lips, they need preauricular, they need everything done. So when someone walks in and they're there for their yearly or every 6-month rejuvenation, that's the state. I'm sure your grocery bill is $500 every time you go in. So I'm not even talking about inflation, but I'm talking about results. So what do I do? How do I price it? $5,000, 2 sessions, 4 tubes per session, full face. Like I said, brow, under eye, nasolabial folds, front of the cheek. Most people, including males, I'll do the anterior cheek or the lateral cheek here. I'll do chin, I'll do nasolabial folds. If I have left over, I'll do the jawline, but I'd also grab calcium hydroxylapatate or filler for the jawline if I had it, because I think it's more robust. And now you're up to $7,000. That $7,000 patient, $5,000 patient is way happier than the $800 patient. And when that patient goes home and they look 5 years younger in a couple of months, and their friends ask them, they're going to say, yeah, it was $5,000. I went to see injector so-and-so or doctor so-and-so or nurse so-and-so. Go see them, get your $5,000 ready. Your practice grows. So that's my bias. You can do anything you want. I mean, we talked 20 years ago about a drive-through practice, and I thought it was a good idea. Botox drive-through, okay? Boom, boom, boom. And people talk about it today. Whatever practice you want to have, you want to be the price point person, whatever you want to do is fine. For me, I get the most reward and satisfaction of that. In general, I wouldn't charge it for if I'm doing 4 vials in a full face single session, I don't see how it would be less than 2,000 or 2,500. It's your time, it's your education, and the results, in my opinion, demand that. And remember, you have 95% of the population out there in the world that isn't doing fillers and toxin. You can now capture that. So it's absolutely huge. I've heard of a lot of clumping in the under eyes, which gives me pause to place it there. Well, then they put it in wrong. Think about what you're saying, clumping in the under eyes. That means, first of all, if I am going to have a lump or bump, I'll take ezGEL all day long. In fact, if you said, hey, you have to go bolus an under eye, and you're going, oh my gosh, I don't want to bolus. Would you bolus it with calcium hydroxyl acetate, PMMA, HA filler, or ezGEL? ezGEL, because you're going to grab it and you're going to massage it and it's going to be gone. So I think, no, you shouldn't see clumping under the eye. Have you filled the nose? I have not. I can't conceptualize that it would be great for the nose. It could be, but I don't do it. I think you need some G prime, you need some force. There's not a lot of vascularity, although of course they're going to tell you it's the number 2 cause of blindness. Injecting the nose, great, but I don't see conceptually that there's enough fat pads vascularity to rejuvenate or to create the result that you want with the nose. 1 in 10 people that come into my clinic for noses are a good candidate. 9 out of 10 I'm going to send to surgery. But again, that's my practice, meaning that's my preference. It's what I do. It's what I think. People go to you for you, and it's your eye and your practice. So for me, that's what I do. Because this is a gel, clogging, so clogged vessels injected into the vessels, HA does. So we talked about that, Valeria. Pop back in and watch that. But you bring up one point I want to bring up: clogging of the cannula. No one asked this yet that I saw, but here's the deal. Okay, let's talk about consistency. First of all, when you mix it back and forth, way back in the day from the Radius days, 2006, 7, you guys have 90% of people probably too young to remember this, but Radius didn't have lidocaine in it, so we always had to mix it up. They did a study, or at least the company told me they did a study, and found that it was 20 times back and forth, meaning mixing lidocaine with Radius to get a consistency. Now, how do I extrapolate that to the gel? It doesn't extrapolate, but I just did 20 back and forth. That makes it smooth. I find if I mix it 5 to 10 times, the consistency isn't right, I clog the cannula. Now, here's another trick. If you've done 20 times and you're going to inject it back and you get a clog halfway through, go back and simply mix it in the syringe again to make it smooth again and inject. You won't have a problem. I've had all the problems I think that can exist out there, so I'll share with you how I overcame them. But it's not a problem if you do that. Does age decrease the efficacy of the platelets and growth factors? Yes. And I think it's a great question. Obviously, you're not going to be able to measure that. How scientifically are you going to measure that? What do we know? Young, if you get exosomes, growth factors, and there's labs in California and different places, they take 20-year-olds and they pay them and they get their growth factors. Okay. And they can culture them. So they only need a small amount. Why do they take young people? Because yes, the growth factors are better. At my age, if I'm eating healthy, if I'm not taking a lot of alcohol, I don't smoke cigarettes, all that stuff, theoretically that should be healthier. But can I say my 30-year-old self isn't going to get the results of my 50-year-old self because the growth factors are worse now? I'm never going to be able to study that in vivo, so in real life. But they're the best that they can get. And I haven't seen high failure rates in old people, other than some of them just need a facelift. If they're coming in and they're not, you got to have candidate selection for threads, for this, for fillers, for everything. But I would say the answer, yes, their growth factor stem cells won't be as good. But am I not going to do the procedure because I'm 50? No. It's what I have, so that's what I'll use. Cannula or needle for full base lip lines? Always cannula for everything. I can't think of an area I use a needle other than hair, and that's PRF. So I think we got through some of these questions here. Maybe here's a couple more. Let's talk longevity. This is a great treat. This is a great question. I'm grabbing a bit of this coffee, so I have some fluids, dehydrating fluids maybe. Okay, let's talk about duration. So I come in, I go, hey, let's just stick with the under eye thing as an example. And I go, how long is this going to last me? Now, you have to decide if you want to take me on as a patient. Like, am I, can I afford this? Is it my last $1,000? Is my expectation realistic? All those things, okay? That goes with everything in the practice. Let me ask you this. Have you ever, if you inject fillers now, have you ever injected a filler and had someone come back a month or 3 later and say, hey, I'm unhappy with my filler? Where did it go? I don't see it. I don't see a difference. Have you had someone say, oh, my under eye doesn't look good. It got, you get lymphatic obstruction. It's more red, it's more full. You won't get that with ezGEL, but just about everything you're going to get with every procedure, you're going to get with this. So longevity is a discussion about what's your expectation, what's your aging rate. If I'm going to get the procedure, I'm going to Vegas tomorrow, smoking, drinking, partying. I know I'm going to have this done every 3 to 6 months, just like fillers, biostimulators. A female whose estrogen's falling down, or someone lost their hormones for one reason or another. A 47-year-old female comes in, they're going to repeat this every year for sure until they're 54, because you're trying to get ahead of everything. Same thing with fillers and biostimulators and everything. So what do I say for longevity? What do I do? Real life practice? Everyone wants an answer, but you got to educate first, because you might not want to treat that patient if they don't understand this. I'm going to treat once. Let's say I'm talking my full face procedure, or if it was nasal folds or in here or lips, but for me, it's full face. So I would treat them today. I'm going to treat them at 6 to 8 weeks, maybe up to 3 months, somewhere in that window. I tell them to come back at 6 weeks. You know how it is. Not everyone can come when you're available or when you want them. But in general, 6 weeks, I repeat it. Okay. And if I did 4 tubes initially, I might only do 2 the next time, or everyone can typically use more because it's growth factors. You're not going to blow up the face. Most times I'm doing 4 tubes, repeat 4 tubes, and then yearly. The caveat, so they'll do this once a year. The caveat is if their estrogen tanks, they're sun exposed, they're drinking, they're smoking, and that goes with their skincare, with everything else. So nothing new. But the gel itself, to give you an idea, the gel, and there's studies on this, the gel, the albumin gel, without the PRF added back, just the gel, has been shown to last 3 months on the wrinkle severity scale. So we know at 3 months, they still had their full improvement. Now, studies are now being done to go to 6 months in a year. I personally don't care. I like the fact that the gel lasted 3 months, but I don't care that it goes to 6 months, because I want the growth factors and stem cells. I'm thinking totally different than I did 2-3 years ago. I don't even think like, how long does it last? Because it's their growth factor stem cells, it's their facial rejuvenation, it's their glow, it's their fat pads. We're not even going to have this conversation in 3 to 5 years, in my opinion. We're having it because of Yelp reviews, Google reviews, and patients own us because we're threatened with bad reviews if it doesn't last 10 years. If you have a complication or they don't like their filler, you want it gone yesterday. But if they like it, they want it to last 10 years. So longevity is a long conversation, but it gives you an idea of how I think about it. What's your technique for under eyes? More superperiosteal. It's a 50-50, 1 strip on bone, 1 strip superficial. The beauty of PRF, keep in mind, it's not filler. So I can treat the lid. How many people now come in because of social media, because people look so good, that we've been able to do such good jobs of faces. We're starting to get their necks, that they're concerned about their lines on the palpebra, on the lower lid or upper lid. Remember, this is a liquid, so you can massage that up and treat the lid skin. So you can't do that with fillers. So there's things you can do with this that you cannot do with fillers. Pricing structure in the full face. Go back and watch this again, Wendy. I did that. So in the replay, you can hear it. Do you do fractional RF right after ezGEL same day? Yes. I let them wait 10 minutes, hydrate them up, treat them with the ezGEL, turn around, resurface. I think you have to be careful. If you're doing deep RF microneedling, you're going to get to 67, 70 degrees C. If you're doing that, the jawline here, yeah, I would not do that same day where you put the gel. Here's the thing. If they have a little submental fat and you're treating the lower jawline here with your RF microneedling to get rid of fat or to sculpt it, you haven't put ezGEL there. So you can combine that. But if you're doing the nasolabial fold or you're doing the cheek, then don't go deep and get to 67 degrees. I would do superficial RF fractionated treatments. Are you injecting same volume as you do for fillers? Pretty much, yes. I inject it to what I see. And again, just like I do with fillers, just like I do with Sculptra, I see them back at 6 weeks. What's the worst thing that can happen at 6 weeks? When they come back, they go, doc, I'm happy. Great. Let's say they prepaid. They're $5,000 and now they have a session left, okay, for two sessions. Great. Why don't you come back, see me in 6 months? Here's some skincare. Hopefully you don't have to see me in 6 months. And at 6 months, I'll see you in a year. And if you look so good at a year, let's just do this at 18 months. That's a win-win-win. The less you have to treat someone, the better. And that's counterintuitive to the way the business people are going to think. But that, in my opinion, builds your business. I never use ezGEL. My question is, how many times should I do the treatments? It's like PRF treatment each month in 3 months, or is it enough with one treatment? Yeah, so that is from Sweden. Ariana, how are you? Hopefully you're doing good in Sweden over there. So yes, just what I mentioned there, I think I answered that. And again, if someone comes back at 6 months and they want another session, great. There's going to be people that want more. How many people? I have people in my clinic, I have to say, don't come back for 3 months. They want to come every 2 weeks now. This is the nature of people. They want to be coming in. Can you use this in the neck? 100%? Yes. Yes. I don't like biostimulators in the neck. ezGEL is great. And if you want to mix PRF liquid with calcium hydroxylapatite, you can do that. And that's great. That's a common one I use in the neck. But if you want to go all natural for your patient, just the gel, love it. Can I add lidocaine to PRP or PRF? There's zero need with PRF. It does not sting. If it stings, you're doing something wrong. How can I say that? Probably over 5,000 faces, okay? The odd one, you'll get sting. Yeah, the odd one in 1,000. But don't add lidocaine. Why? Lidocaine can kill you. Obviously, it's a drug. How do you price the ezGEL procedure? Go back and watch this again. Can you show before and afters of the volume replacement? Do you want to throw that up? If my team, I think that's a great one. Let's look at before and afters. This is good. Okay. What do you use before and afters for in your practice? Okay. Use before and afters not to show how spectacular you are, not to boast, you're using the before and afters so that that patient that comes in gets an idea of what maybe you can do for them. And let's say you look at this before and after and you say, you know what, that's not that great of a result. Great. You go get a facelift and you're better off served by a facelift. You've now done the patient a service. You've now sent her or him to the correct procedure, because with minimally invasive, there's only so much you can do, right? So you want to weed out. You're trying to have the best patients in your practice. The most important thing is not the patients you do treat, it's the patients you choose not to treat. So keep that in mind. So let's just go through before and after. These, what I did so that I could present this to you and I knew what I was getting, I had patients come in for 2 sessions between, and the first session separated by the second one by 6 to 8 weeks. And then I followed them for 9 months. I'm still following them. So we're out 1.5 years now. And so that I could get before and afters. I got 3D imagings on everyone. And I was like, okay, what are the results? So what I'm showing you here are 3 months post 2 sessions, okay? This lady's coming back next week or the week after. I think she's probably out 1 year. And I'm gonna see her. I'll get the new data, very happy. What am I gonna do? I'm anticipating to do 1 session. Now, what happens when you make someone look pretty good? They wanna look even better. So if she wants 2 sessions, great. But I know she's gonna need at least 1. It's been about 1 year. So what did I do here? I do, this is my full face, it's pretty standard. PRF liquid brow, PRF gel under eye, nasolabial folds gel, anterior and high lateral cheek gel, lips gel, above and in the body of the lip and the chin. And I also do the anterior jawline. So in front of your pre-gel, I inject almost everyone, because you want to, almost everyone has a pre-gel sulcus, the downturned mouth that extends to the anterior jawline. So that's what was done here. Let's look at the next before and after. And okay, again, so this is the same thing. The ones that I'm going to show you are all standardized, 2 sessions, 6 weeks apart, pictures done at 3 months. And what we're looking, same treatment as before, treat them all pretty much the same. Different volumes, of course. 4 tubes for each patient, but I'm going to use more on this person's under eye. You can see there's more of an under eye hollow to begin with. And that's all they had done. Okay, so you can just see that improvement in nasolabial folds, a little lifting of the face. Because it's growth factors and stem cells, here's what the patients come back and say. Because everyone wants to put their finger on, oh, is the cheek projected? Is the hollow, which is why I got it done, the hollow at the high orbital rim hollow, which is where I had a lot of mine put. I came in for that. But here's what the patients say, no matter what you do, if you do it properly, they come in, they go, I don't know, doc, I look 5 or 10 years younger. And that's growth factors, stem cells, cytokines. It's an overall rejuvenation. And if that's the practice you want and you want all natural, well, this is probably what you're looking for. So that's what they say. I just look natural. Will anyone know that anything was done? No. So I still get patients. They don't want anyone to know anything was done. And that's what this is. Do you do RF right after injection or can they come back? So I answered that one and fractionate RF right after. And you can numb them. They're already numb. So because they got topical on before the procedure for some people. Have you microneedled with gel? I have not. I don't see the need to microneedle with gel, but certainly you could. If you want to do that, take the PRF clot, get a sterile tray, break up the PRF clot. You can let it clot and microneedle that in because that's concentrated growth factors, or just take the liquid. But I don't see how the gel would help. How do you feel about placing PRF or ezGEL superficially in the 11s between the brows? How do I feel about it? I feel great about it. How do you feel about it? What is your risk tolerance? So the question was, do I do in between the brows? Okay. This is a great question because I feel great about it. Do I do it? Yes. If you go to Asia, you're going to do 4 or 5 people a day. It's like injecting toxin in the frown. Okay. What's the risk tolerance over there? It's way different than here. They're doing sliding genioplasties and you can have anything done you want. Break the jaw, put it back together, whatever you want to do. In America, if you want to do that, we know, I would say that there has not been a reported case of occlusion, nor do I ever want to hear or see one. But this and the nose, of course, is going to be a risky area. You're injecting a clot. Okay. So even though there's no cases, if you want to do it, do it. You know, you're practicing medicine. It's your practice of medicine. I think the relative risk of an occlusion or blindness, we know, is very, very, very low. But in the United States, it's a litigious society, right? So 99% of all the lawsuits in the whole world occur in the United States. 99% of all lawsuits in the whole world. So do you want to still do it? Never been a problem before, but I would say you would think about that. For me, I think about who I want to take that risk with, and I take that if I want to take that on. But you can do it, certainly. Why not do threads or something else? But you could do it. What depth is ezGEL injected? This is great. I think this is great. So Kelly, good question. So I mentioned already superficial and deep on the bone and superficial under the eyes. Great, we got that. In the fat, I'm really playing with fat pads is what I think. So I'm in the fat pad in the cheek. If I want bone, because I really do believe from the studies and what we're doing that I think you can get bone growth. So I will put, if I really want, if it's a female wants a high cheekbone, I will put a strip on the bone. And then I'm always treating fat pads. The bone will be questionable. Where am I on bone? The orbital rim and the cheek. I'm in the fat pad here in the lower face. For a female particularly, which is still 85% of most of our practices see females, 15% are males. Females get loose skin here as they age. I have loose skin here as I age that I see. So think about females when you got thinner skin or skin type 1, 2, 3 with bone loss. So you got to address the fat pads here, especially for females. So I'm in the fat pads a lot. And on the brow, for hair, I'm just in the fat pad. There is a little fat pad up here. How often do you tell people they need to come back for a touch-up? Again, I would say 95% of people practices are going to change the way they think about aesthetics and should. So you can come back whenever you want. I have people that want to come back for a touch-up every month or two. And I got to say, hey, maybe make it 4 months. You want to see what they can do? So maybe make it 4 months. But if someone wanted to touch up at 3 weeks, see them back. The nice thing is it's a blood draw, and I can get a blood draw on a person. So it's not a big deal. So touch them up when they want. But I would say, like I said, 2 sessions and then repeat yearly. Let me see here. I can get some questions done. Okay. Do you have a POC CBC device actually checked? Yeah. So no, I have a CBC device. I have a blood analyzer device, so I can check blood draws. I can check what's in the tubes in the office. Okay. But do I check people's platelet counts? Not at all before doing the procedure. I don't know that it would help you or get a CBC. There's separating gel in the ezGEL. No. So it can trap lots of platelets, right? Absolutely not. You do not want a separating gel. And in many countries, when you're lecturing or talking to people, they will tell you, hey, what's in that gel? And could that gel be giving off little pieces of something that's going into the body? You tell me what that gel should be made of. Let me put the question to you. What should that gel be made of? So no, there is no, and that is a key point. It's what makes it work. It's what we don't want. It's you're pulling out the right amount of product from where it is, which is very easy. Safe in pregnancy and breastfeeding moms. Well, why wouldn't it be? But here's what. I told you about the society we live in. I treat 0 people breastfeeding. I treat 0 people who are pregnant, because if that kid doesn't go to Harvard by the age of 18, I might be culpable. So no, I don't treat any. Why would you? They got estrogen running around. They're going to look better than they ever have. Aside from the procedural aspects of hemostasis, what does a patient who is anticoagulated affect this process? Yeah. So I get them to know their INR. Let's just say someone on Coumadin. Obviously, if they're on Plavix or other platelet inhibitors, not a problem. Never seen a problem with it. But people are on Coumadin. I like to know their INRs, where it should be, between 2 and 3, whatever their target is. Obviously, well above that, I wouldn't treat them for other reasons. Not a problem. Never seen a problem with it. But theoretically, I think you bring up a great point. But keep in mind, when you spin the blood, it's about the growth factors and stem cells that hang out with the platelets. So, but yes, because it's a gel, we're still going to get them hanging up in the gel. You're not going to maybe form the fibrin clot like we want, but we got the gel, so we don't need it. ezGEL for PR for hand rejuvenation. Yes, use the gel for the hands, and I use a cannula. So just my practice on that. But yes, thoughts of PRP or PR for hair rejuvenation or PDO threads. I don't use PDO threads for hair rejuvenation. I use PRF plus or minus ezGEL for some people. $2,500 a session. I usually repeat it every year to 3. How long between both sessions? 6 weeks. How long will a gel last? We went through that. Go back, Heather, and you can watch this again. We went through that. Let's see if anyone has any further questions. Do we have any more slides to go through? Okay, great. We'll do one more question, and then you guys can watch again and reach out to me. Certainly aesthetictrainingcenter.com. There's a course there where you can watch it all being done. Reach back out to me through there. You get a dashboard. You get direct access to me to ask questions. I learn a lot from all of you guys. Can this be combined with a chemical peel? Absolutely. Yes. And if you're putting the PR, you got to start with it. If you're doing chemical peels, you have to start with an acid face. So meaning that's why we use phenol, or some people use alcohol. Phenol is better. But remember, you may have had topical anesthetic on the face. You got to fully clean that off. Because if you want your chemical peel to work well, you don't want to start with a pH, high pH on the face. You want a low pH. So that's one thing to be mindful of. And then keep in mind, I wouldn't do a deep chemical peel because they are healing and you don't want to get a lot of callbacks, but it would be fine. Treatment chest décolleté, absolutely. So that's a bunch of questions. Just reach out to me specifically if you have other questions. Appreciate all of your time on the webinar today. I want you all to go out and have fun with this. This should be fun. And remember, consistency is the key. It's 5% brains, 95% consistency and staying power. So stay the course, keep me posted, and let me know all about your success with the procedure and how you're liking it. Thank you very, very much.